There's a compound found in black pepper and cloves that researchers are now studying for bone protection in diabetic osteoporosis. And the mechanism involves something called ferroptosis, which sounds like a villain in a Marvel film, but is actually a form of cell death that's genuinely relevant to bone loss. That's in today's episode, along with a Nordic walking study that has some actual good news in it, and a rare cardiac condition that came up in a context I didn't expect. Stay with me.
Hi there, I'm Tony Lee, and this is Hot Flasher, your daily menopause podcast that serves up fresh news, research, and wellness tips. I've built a daily news pipeline to find the latest on women's health and menopause research. Allow me to introduce my co-host Nykki, who handles the headlines. Take it away, Nykki.
Thanks, Tony. We've got a genuinely interesting mix today. Let's get into it. I want to start with something that came out of a clinical case study published this year, and it touches an intersection that doesn't get nearly enough airtime: the relationship between mental health treatment and cardiovascular risk in women. The paper from Nguyen and colleagues in 2026 documents a case of Takotsubo cardiomyopathy triggered by electroconvulsive therapy, ECT. If you're not familiar with Takotsubo, it's sometimes called stress-cardiomyopathy or broken heart syndrome, and the name comes from a Japanese octopus trap because of the shape the left ventricle takes when it's affected. The heart's left ventricle temporarily balloons out and stops pumping efficiently. It's typically triggered by a sudden surge of stress hormones, physical or emotional stress, and it can look like a heart attack on presentation. Most people recover, but it's serious. What makes Takotsubo relevant to this show specifically is the demographics. This condition skews heavily female. Research has consistently found that women, particularly postmenopausal women, make up the vast majority of cases, somewhere in the range of 85 to 90%. The leading theory is that estrogen plays a protective role in how the heart responds to catecholamine surges, which are those stress hormones, epinephrine and norepinephrine. When estrogen drops after menopause, that protection may diminish. The heart becomes more vulnerable to the kind of acute stress response that triggers Takotsubo. ECT causes exactly that kind of acute physiological stress. It's a procedure that involves inducing a brief controlled seizure, and it creates a significant sympathetic nervous system surge. The paper's authors are flagging that as a potential trigger mechanism, which makes physiological sense. ECT is also a treatment that's increasingly considered for severe treatment-resistant depression, and perimenopausal and postmenopausal depression is real. It's underdiagnosed, and it sometimes reaches that severity threshold. This is a case study. One patient. You cannot draw population-level conclusions from a single case report, and I want to be clear about that. The research credibility bar for a case study is appropriately modest. It documents something, raises a hypothesis, and signals that more investigation is warranted. It doesn't establish causation or frequency. Your doctor who uses a tool like Open Evidence to look at the evidence base for ECT candidacy in menopausal women would not find this single case study sufficient to change a treatment decision. But here's my actual position on why it matters. Women's cardiovascular risk post-menopause is systematically undertreated and underappreciated by the medical system, and any research that builds a case for paying closer attention to that risk in the context of other treatments is worth having in circulation. If you or someone you know is weighing ECT for depression and is postmenopausal, this is a conversation worth having with the treating team. Not because this one case study is definitive, but because the broader picture of cardiac vulnerability in postmenopausal women is real and documented, and it should be part of how treatment risk is assessed. The cardiac monitoring that typically accompanies ECT should theoretically catch a Takotsubo event. Whether clinicians are specifically alert to it as a possibility in postmenopausal patients is a different question. Now, the Nordic walking study, because this one actually gave me something to feel decent about for a Sunday morning, and those don't always come along. The paper is from Liu and colleagues, also 2026, looking at the effect of high-intensity interval Nordic walking, combined with strength training on biomarkers of metabolic syndrome in postmenopausal women with abdominal obesity. Nordic walking is the one with the poles. You're engaging your upper body, your core, your arms, not just your legs. It tends to increase caloric expenditure and cardiovascular demand compared to regular walking at the same pace. And it's low impact enough that it's accessible for a wide range of fitness levels. The study found improvements across several metabolic syndrome biomarkers in the postmenopausal women who did the combined program. We're talking markers like fasting glucose, triglycerides, waist circumference, and blood pressure indicators. The combination of high-intensity interval Nordic walking with strength training moved the needle in a meaningful direction. Now, the study design is quasi-experimental. That's a step down from a randomized controlled trial. Quasi-experimental means participants weren't randomly assigned. There was likely a comparison group, but without the randomization that controls for baseline differences between groups. That matters because if the women who chose to participate in the exercise program were already more health motivated, had better diets, or had different baseline metabolic profiles than the comparison group, some of what looks like a treatment effect might not be. This is a structural limitation, not a knock on the researchers. Quasi-experimental designs are often what you can actually run in real-world settings. So, I'm not going to oversell this as definitive proof that Nordic walking cures metabolic syndrome. It doesn't work that way, and the study design doesn't support that claim. What I will say, and I'll say it directly, the broader evidence base for resistance training and vigorous exercise improving metabolic markers in postmenopausal women is actually robust. This study fits a consistent pattern. Strength training preserves muscle mass at a time when metabolism is slowing and fat redistribution toward the abdomen is hormonally driven. The combination of cardiovascular work, especially when it's genuinely high intensity, not a leisurely stroll, with resistance training addresses both the metabolic and the musculoskeletal challenges of the postmenopausal years simultaneously. The Nordic walking angle is interesting specifically because upper body engagement adds a dimension that regular walking misses, and a lot of women who can't run or don't want to find it genuinely sustainable. If this study gets other researchers interested in Nordic walking as a tool for this population, that's a worthwhile downstream effect, even from a quasi-experimental design. The third item is the one from the hook, and it requires the most nuance because it's the easiest to misread. V, caryophyllene, BCP, if you want the shorthand, is a compound that occurs naturally in black pepper, cloves, and several other plants. It's a sesquiterpene. It has some well-documented anti-inflammatory properties, and it's been studied in various contexts. This paper from Fan and colleagues published in June 2026 is looking at its potential to protect against a specific and serious problem: osteoporosis in the context of type 2 diabetes. Diabetic osteoporosis is its own category of bone disease. People with type 2 diabetes have elevated fracture risk, even when bone density measurements look relatively normal by standard metrics. The structural quality of the bone is compromised in ways that DEXA scans don't fully capture. That's a known gap in how we screen and assess fracture risk in diabetic patients, and It's a problem that disproportionately affects postmenopausal women who have both menopause-related bone loss and diabetes-related bone quality changes happening simultaneously. The mechanism this paper focuses on is ferroptosis, a form of regulated cell death that's driven by iron-dependent lipid peroxidation. It's distinct from apoptosis, which is the more familiar programmed cell death. Ferroptosis has emerged relatively recently as a research target in bone disease because it appears to contribute to osteoblast death. Osteoblasts being the cells that build new bone. If you can block ferroptosis in bone tissue, the theory is you preserve more bone building activity. BCP appears to do that in this study through activation of the AMPK NRF2 pathway, which is involved in cellular stress response and antioxidant defense. The results showed bone protective effects in a diabetic osteoporosis model. Here is what I need to be very clear about. This is preclinical research. The model here is not a human clinical trial. The gap between this compound does something interesting in a preclinical model and this compound is effective and safe for humans at a therapeutic dose is enormous, and that gap is where most promising compounds eventually stall. The supplement industry does not wait for that gap to be closed before putting things in capsules and putting them on shelves, which is something worth keeping in mind if you start seeing BCP marketed for bone health in the near future. I'm genuinely interested in the ferroptosis angle because it represents a different mechanistic target for bone protection than what most existing osteoporosis treatments address. RANKL inhibitors, bisphosphonates, estrogen. None of those work primarily through ferroptosis pathways. If this line of research develops, it could eventually open a therapeutic door for the diabetic osteoporosis population that isn't currently well served by existing options. That's worth watching. But at this stage, the honest summary is compelling mechanism, interesting early data, nowhere near clinical application. And if someone tries to sell you black pepper extract capsules as bone protection based on this paper, they're skipping about a decade of necessary research to get to your credit card.
Thanks for listening to Hot Flasher. We're back tomorrow with more, so don't forget to subscribe. See you tomorrow.